So here we are in Korle-Bu Hospital in Accra, Ghana, and I'd like to introduce Dr. Eric Wongo, who's from Sierra Leone, and he's a plastic surgery trainee who's currently undergoing a training program here. And I'm going to ask you, Eric, first of all, why are you here in Ghana doing this rather than in Sierra Leone?
Thank you very much. In Sierra Leone at the moment there is no postgraduate training, and so after your medical school training you're forced to leave the country if you want to do postgraduate studies, and that is basically why I'm here. Fortunately for me, after my housemanship, I came into contact with Martin Webster of the research charity, and the organization decided to sponsor a doctor to help with our plastic surgery challenges back home. So
okay.
That's why.
So does that mean that with respect to burns, for example, in Sierra Leone, is there any training either for nurses or for doctors or for therapists even in managing burns? Is that something that is available or not really available?
Not really. There's no formal training in burns. Most of what we have been practicing back home has been based on what our senior colleagues who probably trained in general surgery, for example, passed on to us. So there's no formal training at all at the moment.
And what are the biggest challenges, do you think, again, really relating to burn injuries? What are the biggest challenges in Sierra Leone relating to burns?
I think educating the people, the populace about how to prevent burns in the first place, and then first aid, how to immediately manage burns at the peripheral centers. And then once they get to the tertiary hospital setting, the problem is with the lack of formal training, managing resuscitating patients and and all of that becomes quite a problem. So the main issue is education and training staff to actually properly handle burns patients. We do encounter a lot of burns patients, ranging from all age groups. The children are exposed to hot water burns, especially at a certain time of the year when the weather's cold, and maybe the mother leaves the child near some pot of boiling soup and then they get burnt. And once they get to the hospital, resuscitating these patients properly becomes a problem. Monitoring the urine output and all of that, assessing the airways, breathing, circulation, and having special treatment, care for them is really a challenge.
So do you have, in the whole of Sierra Leone, is there any one hospital or one facility that's specifically dedicated to burn care?
As at the time I was there, no. The Connaught Hospital is the main tertiary hospital in Freetown, and there was no specific burns unit attached to the hospital. And those who actually managed burns patients were not specifically trained. As it is at the moment, there's no plastic surgeon in Sierra Leone, so they were mostly managed by general surgeons. And so there was a lack of finesse, I could say, of a plastic surgeon handling such cases. So we had quite a few complications, as you'd imagine. And then, with the contractures and things, now it becomes a problem managing those cases as well.
So if you had a magic wand to try and, what would you suggest to try and improve the situation with regards to burns patients and outcomes for patients in Sierra Leone?
Well, I would, from the bottom of my heart, ask for more training for my people back home, hands-on training. I think it's very essential. There really isn't much in terms of what Ghana has achieved as a nation. I think what they have is more of the expertise. They have people coming over training, and if we had that facility back home, it will make a lot of a difference. It will. So I think the emphasis should be on training and more training for the people back home in Sierra Leone.
Eric, thank you very much.
Thank you very much.